I was actually looking on Reddit. I can't remember what I screenshot. Oh, now I remember. There was somebody on there that posed a question. This was in the public health or the public health career section. For anyone that works at CDC or HHS, if you're not sure what that is, just go look it up. It's related to public health. How are things over there? And one of the moderators immediately disabled the comments and said, "We're disabling the comments. If anyone wants to talk about their experience, please reach out directly so we can assure anonymity." So why would they do that? First of all, they don't want to be responsible for anyone getting fired. A couple little birdies that work over there have said that they have hired and brought in all these fresh out of college people that are walking around in suits, just monitoring people, monitoring their computers, monitoring all kind of stuff. And they've gotten rid of the scientists, the doctors, nurses, people that are involved in research, microbiologists, veterinarians, dentists, doctors, osteopaths, physical therapists, respiratory therapists, some of the nurses that were there, the health scientists, the biologists, everyone that's involved in research. And they have like people that are, you might have a supervisor and their admin person. You have the supervisor and the admin person, a supervisor and a secretary, a supervisor or a bookkeeper. Okay? What are they there for? They've gotten rid of all the scientists. And if you look online, you'll see there's one company that I noticed. I'm just thinking of one right now, okay? Seneca Holdings. That is, it's a company, a holding company, and it is owned by the Seneca Nation. So they have job openings. And there's been some other places. That's just the one that I could think of. That's the one. But there's other companies, not just Seneca Holdings. And when you look on there, it's pretty impressive. Just go look at it and you'll see a lot of the public health openings. The company that I work for, the contract company, they had so many public health openings. That's where I actually got my job. I'm not going to say the name of the company, but I look on there, they don't have any job openings in public health anymore. I have a lot of empathy for people that are currently going to school for public health and getting out right now. And if you go on Reddit, you will look and see, they'll say things like, I'm concerned, I'm this, will I be able to find a job, this. How can I break in and get an internship? Some of them are changing plans. If I was you, I would find some kind of terminal degree that you could go back to community college and get something in. You already have science classes, maybe go look for something where you can get it for 2 years. Or if you already have that degree, see if you can get into an accelerated program. Go become a physician assistant. Maybe go into nursing, respiratory therapy. I would look into, if you're in a state where they're not very progressive, I would look into places where they're part of the alliances. Now, there are certain places on the East Coast that are forming public health alliances. I would look there. Now, if you're going to the West Coast, you have California, Oregon, Washington, Hawaii. But they also have one on the East Coast of the United States. Just type in what current states are in public health alliances, and those are the places that I would go to. I say this because the CDC, the director that they got rid of because she wanted to follow the science, also this other medical director, they're all working with the in California. So if you are in public health, I would be gravitating towards those states that are part of those alliances, because they're going to be relying on the science and coming up with the recommendations.